Well, here I am in the august presence of a legend in the field of GI surgery in India. If I can think of Dr. Samran Nandi from northern part of India and Dr. Rangabhashan from southern part of India, it is Professor S.K. Mathur from the western part of India. Eastern I really do not know. Welcome, sir, to a open heart session with me. Thanks for joining me. Now, where do you originate from?
Okay, so first of all, thank you, Patta, for inviting me for this. I have seen your interviews with Professor Nandi and Professor Kapoor and Punitdar and all that, and I enjoyed those, listening to them. So I come from a district in Madhya Pradesh, MP, and where I was born. This is called Vidisha. It is a district near Bhopal, the capital of Madhya Pradesh. And that time it used to be called Madhya Bharat. The reorganization of the states have not happened at that time. So this was somewhere in 1949. And my parents were middle class family. My father was a government servant. He started his job as in the clerical job, but rose to become a Naib Tahsildar. So that was my background.
And your schooling?
So my schooling was basically because my father used to get transferred he was in the revenue department, and as per their department requirement they used to move. So
that is within Madhya Pradesh or outside?
Within Madhya Pradesh.
Right.
Within Madhya Pradesh. So like it was in Vidisha, like my first standard. Then second standard was in another district, is Guna. Then third standard was another Tehsil area, which called Pichhor near Shupri district. And then I was back in Vidisha for my part of third and fourth. Then back in the Pichhor for fifth. And then I was in the Raghogarh, which is near Guna, from where the Digvijay Singh comes. Right. His father was supposed to be Jagirdar of that place. So, and then finally by 8th standard, we were at one place, that was Guna district. So 8 to my BSc part 1, that is the pre-entrance for the medical school. I was at one place, Guna. And then medical school, I got admission at GR.
Why medical school? Why not engineering school or some other school?
So it's a story, see, because at one time in my life, right from childhood, I was an ambitious child, let me put it this. I wanted to be on the top.
Oh, right. You were on the top.
So, so in the studies, yes, I was on the top in the class, always. But from third standard, I started falling sick.
Okay.
So I had first the typhoid fever, the relapse of typhoid fever. So I have seen, now this is the place which is the Tehsil place.
Right.
Okay. And government hospital, their doctors, they treated me, and I'm thankful to them. I bow to their competence of treating at that time. Okay. So I had that. So there was a loss of my studies for almost 3-4 months. And then my father got transferred to Vidisha, and then I joined just 1 month before the exams of 4th standard. But ultimately I studied and came on the top that way. So my illnesses were, at that time I didn't think of that I will become a doctor, but they played the role. There was a time when I was in the second standard in the Guna district. My father had gone, because of a touring job for him. So he had gone on the tour, and that was almost 1 month out of the place. And I felt like I developed diphtheria. So in the middle of the night, my respiration was getting choked. And then my mother called the neighbors and my father's colleague. So they took me to the district hospital in Guna. And there the civil surgeon who was there, Dr. Raina Karke, he was a tall fellow, I still remember him. And they said that it's 48 hours time. At that time penicillin was the injection which was required, big injection, big needles. I got that, they admitted me. And she told my mother that in 48 hours we'll see what happens, because that time diphtheria was killer. Killer. And by the time my father could be contacted, because there were no telephones and all that, telegram went, and by the time he came, I was home. So there I saw him as a personality, and he will come and talk to me on daily basis. And somewhere I got impressed that this is the life I want to be, because he saved my life.
Right. He was a physician.
Yeah, he was a physician. And he was civil surgeon.
Civil surgeon, right.
The designation was the head of the hospital. And I also saw the suffering in the general ward. I remember that there was a child next to my bed whose hand has been eaten away by the tiger. So his dressing and all things used to be very painful, and from poor family he used to come. As a matter of fact, I used to tell my mother to get some food from home for him also.
Right.
So all those things affected my mind somewhere. Though at one time I used to think, used to ask, because my father's colleagues and the seniors officers who were there, so I'll ask them. I had this curiosity. So even that time, though I was supposed to play with my age group people, I will do that. But in the evening, when these people are sitting, I will quietly go and listen to what they are talking about.
Okay.
About their office work, politics, and all that thing. And so I used to ask them that which is the most powerful post, and where you get more money and all that thing. But the powerful thing was, so means I thought, yes, I should become like this, I should become like this. But then all these medical conditions and my interaction with the doctors in the government sector, they played a role in my life that I said, no, I want to become a doctor. And also my mother fell sick once, and I was very much attached to mother. And this was around when I was in 6th standard. And she was quite serious. But again, the very competent doctors at the tehsil level could save her. And that day I decided, no, I want to become doctor because I think I should save the lives.
Right.
That was the...
Which medical school did you go to?
So I went to this called GR Gajaraja Medical College of Gwalior. So that time the admission used to be on the BSc Part 1 marks.
Right.
In MP. That was there were no entrance exams. And the BSc Part 1 used to be, because you are studying up to 11th standard, the higher secondary school was in Hindi medium, and then suddenly you are going into the English medium.
Right.
Everything used to change. So it used to be like the pass rate used to be 10% in the BSc Part 1. So
Okay.
And on the basis of the merit, then in the division, so each division, like Gwalior division had one medical college, Indore division had one medical college, Bhopal. So whole divisions, all the districts, there is a merit list, and the one who are there, 150 seats were there. So those who are on the top, there, of course, reservation, all that thing. So I was topper in the university for in my stream.
Okay.
So that's how I got into the medical college.
What is unforgettable in your... I'm sure you've been a very studious person all through MBBS, or
Yeah,
it took life easy.
So thing is that, yeah, I was studious right from beginning, but apart from studious, I think I was observant. That was the thing that if I observe something, I'll remember it.
Right.
So in the house also, if there something is kept somewhere and everybody is forgotten, and then they will say, no, ask him.
Okay.
And somehow I observed, and then I say, go in this place and this place, you will find it. Which happens today also, because I keep my things, and even in the night, if it's during night, I know where to pick up and I'll get it. So it's just a
Now, what prompted you to take up surgery as a career?
Yeah, so in the medical school when I entered, now one thing which I want to share with you, because though you can say that my father was in the government job and all that thing, we are a big family. 3 brothers and 5 sisters and all that. And he was a honest, very honest person, to the end that when he retired, he didn't have any property for engineering,
Right.
which he could have made a lot.
Yeah, in the revenue, that too.
revenue department. And so that honesty and my mother's teaching to me were very basic foundation for that. So naturally, by the time I entered the medical school, my father didn't have money. He was at the verge of retirement, or 2-3 years remaining, and my elder brother was just getting into a job which was not paying too much. And so there was an issue. I got the admission, but I didn't have the money to pay for the fee.
Okay.
So I had to take the loan.
Ah.
So my elder brother-in-law, he gave me the loan for depositing the fee for that thing. And the only advantage that I knew that I was married, so I will get the scholarship. So I knew that I can pay it off and I can look after my thing. And the Gwalior, my parents were in the Shupri at that time, so Gwalior I had to stay in the hostel. And buying the books and all that thing. So it was tough. So for at least first year, in the evening, I used to take the tuitions for the 11th standard students.
Really?
Yeah, teaching them physics and chemistry. So that did affect my studies in the medical school in the first year. But I liked anatomy, and anatomy was my favorite subject.
Right.
Not so much of physiology. And we had very good teachers. Also, usually after the dissection, everything, when everybody is running home, I'll go to the museum and study those specimens and all that thing. So that helped me. I think there was something going on that I will become a surgeon, though I did not decide it.
Right.
Once we got into the clinical side, we had a professor of surgery, Dr. Dharkar. He was actually second generation neurosurgeon of the country.
Ah, right.
At a place like Gwalior, under all the restricted means availability of the things he used to say. So he was very impressive personality, and plus he was a very honest person. When the private practice was allowed, he didn't used to do private.
Oh, right. Ah.
So he was and very caring for the patients, and of course good surgeon. So he impressed me a lot when I was getting in the clinical thing, and somehow or other I found that surgery to be more attractive and precise, more precise than the medicine. So when we talk about the differential diagnosis syndromes and all that thing, I said, this is not the thing what I want to do. I want to be more specific. So that's where the motivation came.
And did you have any gap between MBBS and general surgery, MS general surgery, or you continued?
No, I continued. So there was again, see that these things don't come out otherwise, but I can share with you. So when I finished my MBBS, so that year, in the final year, I stood third in the university, and I was second in the surgery. There was a girl who had 2 marks ahead of me,
Okay.
but she was not taking surgery, so there was no issue on that.
Okay.
So I was to get the surgery, definitely. And during internship, I took my internship very seriously.
Right.
And particularly surgical posting. So I did even gynae posting. I was very sincere. So I used to do the DNC and the TL and sometimes assisted hysterectomies and all that. So I used to enjoy all that.
Right.
And same thing in the surgery internship. The unit in which I was posted, the house surgeon suddenly decided to leave the job. And he was told, you can be relieved only if you provide a substitute. So he was my friend. So he said, Mathur, will you work as a house surgeon also? I went, okay, I'll do it. Means extra work.
Right.
File work. So I enjoyed that, and that was the thing that it sealed off my fate that I have to become a surgeon only. And there was no gap. So the moment internship got over, I was in the list to get into the surgery. So we were 5 people who were married who got into it. But that time, what happened that only first 2 will get the paid job, the rest will be honorary. And I was third
That's
on
the
that.
Madhya Pradesh rule.
That time, I'm talking of the 72.
Okay,
72. So, and then again the financial thing came. My father is retired by that time.
Right. So you're obviously not born with a silver spoon.
No. So
No spoon.
yeah. So that only thing, my scholarship used to help me a lot.
Right.
My scholarship used to help me, and then I could manage that thing. So that time the state jobs were there. So I have applied for that in case, and I got selected there.
Okay.
So I got an appointment letter to the state and talked to my father. So he said, "What do you want to do?" I mean, I want to do surgery. There is an option that I may go for this and come back after 2-3 years and do this. But somehow I was not very convinced that I go for 2-3 years gap and then come and do the surgery. Fortunately, this is where I believe in the God. He comes to the help. That is the time all over India there was a strike of the residents for stipend increase and bringing out the residency system.
Okay.
73.
All India.
72. All India. All India.
Right.
And that brought the fruit. And that system of not paying the resident went away in all the states, including MP. And the moment that came, it gave me the breather to continue not to go for the state job. So I did in one go in the 3 years.
How are you different from other surgical trainees in terms of dedication, learning, and spending time in the wards and reading?
So fortunately for me, out of 5, 4 of us were very sincere people. Over sincere means, and so we will be there all the time. We didn't have a hostel accommodation, so I used to stay at home. It was 5 kilometers from the hospital. So at 5:30, 6 o'clock, I will go by bicycling to the ward, start my rounds, because by 7:30 the registrar comes for the round. So by that time I'll finish the round, write all the notes and everything, and then registrar's round, then the lectures round, then the boss's round, and all that things used to complete. And by the time you finish the evening rounds and the night, it used to be 12 o'clock in the night.
Every day, literally.
This was like every day.
So that your teachers, professors, are they full-timers or part-timers?
Yeah. So
they do private practice?
They were full-timers. But in MP that time private practice was allowed after so their office hours at that time was like in the morning they will come, so 1 o'clock, then their lunch to 4 o'clock is the gap, again 4 o'clock they will come. So it was different type of
4 they'll come and then go back what time?
Around 6:37, that's the thing.
That's long hours.
Yeah, so that's and then some medical people will have their clinics outside. Surgical people will also have, and they may.
So, but they're dedicated teachers.
They were dedicated teachers and surgeons. So their involvement in the hospital was much more, and some of them used to do private practice. It was allowed officially, and so they can operate in some nursing homes and all that. There was no big hospitals at that time. But my own chief, Dr. Dharkar, he opted for
not operating.
He said, I will not do the
Which surgeries interested you? You started liking abdominal surgery?
No, so at that time, see, I will tell you, I got interested in neurosurgery. I used to assist him in the boreholes and all those things, and brain tumors and all the prolonged surgery. It used to be 8-9 hour surgery. But I got interested in that.
Right.
As a matter of fact, when I finished my MS surgery, I was totally decided that I will want to become neurosurgeon. So I went to him and I told him when I passed the MS. So fortunately the post fell vacant at that time. So he said, okay, you can join. He liked me, so he said, okay, you can join. As a matter of fact, my thesis topic was on serotonin and CSF in neurological disorders. Which was something very basic research.
Right.
and which I had to do in the DRDO lab, this defense lab in Gwalior, because there is spectrophotometry nowhere it was available. And to measure the serotonin, the base, I have to ask the Merck company. So that time, see, the relationship with the your medical representative was not of giving the gifts and all that thing. The Merck company representative, I asked him and say, I want this serotonin base for doing the testing and all that thing, research. And he wrote to his boss and the Germans, Merck, they sent me the thing, free.
Really? Great.
So I used to do that lumbar puncture on the patients with the brain tumors and all that, to collect that CSF and take it there. And we used to, once a week I will go and do all the research work. So that was, the interest was already there. And again, why neuro? Because I found that I had neurology and neurological examination, and if you see the physiology and anatomy, they are very like mathematics.
Right. True.
You know the left side, right side, upper motor, lower motor, vertebra, kahan pe the tracks are crossing, so you can calculate if there is a paresis of this area, this is the level it will be. So all that thing was very appealing to me.
Right.
So I joined the department, the appointment was there, and so thing was that yes, I will do the MCH neurosurgery. But that is the time offer came for my marriage. And this was just out of blue. My wife, she was in Delhi. She was a student of Lady Harding Medical College. And she was doing her MD gynae. And her father approached through somebody, my father, and those things. And this is the destiny. So we met, and I said okay. But then things came, okay means what? Then I had to move out from Gwalior.
Right.
Okay, I can't.
Why should you?
Yeah, so it happens that she already got the job by the time in Delhi. So she became medical officer. She was selected by UPSC, so she was a medical officer in Delhi Municipal Corporation. And so naturally one job. Then second thing, financial situation at home also. Because at that time we used to get 400, 500 rupees, which are not much. So then I decided, okay, I will move to Delhi. So then I applied for the senior residency in general surgery in Maulana Azad. So then I decided that now I need, if I want to go to this general surgery, then I have to get more training.
Right.
The exposure what I got in Gwalior was not good enough, not advanced.
Right.
And one of my senior was already working there as a senior resident. So he said there is a lot of good work here and advanced work. Like, okay. So I applied and got the job there. That was the reason I have to move out. So that was the move when I joined the Maulana Azad Irwin Hospital it used to be.
Which year was that, sir?
So that was 75.
75. And Mrs. was in which hospital? So
she was in Shahadra General Hospital at that time when we got married. So that year we got married in July. And fortunately that Maulana Azad had their quarters for residents, marriage quarters. And so I got the
but isn't that a cultural shock for you, coming from Madhya Pradesh, from a smaller place to Delhi?
Yes, it was. So see, this is where the my inner feeling, ambition to go on the top.
Right.
Means whatever you want to do, you have to go to the top.
Right.
You can't just remain mediocrity. So
how was the surgery culture in MAMC as compared to Gwalior?
See that as far as the hard work and all these things, that was the same. There was no difference. Yes, the facilities were better. The teachers and the whole thing, there was a full-time system. Okay. Yes, there level of knowledge and expertise was more than what I could get it here. So that was the big advantage, and the atmosphere was different. So as a senior resident in Maulana Azad, at least, I don't know whether you worked there or not.
No, I am not.
It was a full responsibility on the senior resident.
Right.
Because the PGs to the house surgeons, and in emergency you are the boss.
Right.
Rarely you have to call the chief
Right.
or the senior. The most lecture person, you can call them for opinion and all that thing, for taking care of that. So, lot of responsibility, and then lot of opportunities
Right.
that came. And
You started enjoying working.
Yeah, I enjoy work, but it was like again workaholic. So morning, you go for the round. I used to by 7 o'clock I will be in the ward. So take the early morning round with the night housemen because they had a culture.
But now you have a wife at home. You have to get back home.
So she suffered. She suffered.
Really?
Yes, she suffered. So early morning, 7 o'clock, I'm in the ward. By 9 o'clock, finish whole round. And there was used to be big wards.
Right.
And then the chief comes, you take him for the rounds. And if it's a post-emergency, that emergency thing, you are awake all night. Because one of the Irvine Hospital emergency means it was,
very busy.
you have got busy, means there will be some stab injuries, laparot means some head injuries. So there were head injury also, there were no neurosurgery department.
Oh, right.
So we had to,
General
but that my old training
Right,
when
right.
doing MS,
Yeah.
that came handy for me to do the bar holes and all that and
Okay.
teach the students. And so, means 3-4 laparot means in the night is a common thing. So
Right.
you are almost awake except few hours naps here and there. And the next day you have rounds and then planning for the OT after that.
Right.
So post emergency, and then the next day is the operation theatre. So I had good bosses. My first boss was Dr. S.N. Budraja. And then I changed to unit Dr. Anand Prakash, who was there.
Atma Prakash.
Anand Prakash.
Anand Prakash.
Dr. Atam Prakash was my MS examiner.
Oh, really?
He was my MS
Okay,
examiner.
okay.
So he was there. So I learnt a lot from them, but they gave quite a free hand
Right.
to do the work. And so that's where this monolayer closure, I published the articles in the beginning at that time. So we used to have a lot of burst abdomens.
Right. Oh.
At that time, with chromic catgut closure, layer closure, and all that. And also this your incisional hernias later on. So that is the time the articles started coming, Jenkins articles and all that thing about the monolayer closure of the abdomen to prevent the burst abdomen. And I hated the tension sutures.
Okay.
They used to leave the ugly scar on the skin and all
right.
that, cut through. So I talked to my chief, Dr. Anand Prakash, one day, and said, see, I want to try this. He said, okay, don't force me to do it. So all emergency laparotomy, I learned that technique, read it in detail, and started using monolayer closure for that. And the burst abdomen incidence came down.
Okay.
So then the first 100 cases we published it at that time.
Who prompted you into this article writing, data
So
collection?
yeah, Dr. Anand Prakash was, he was quite academic that way. So he said, you should write the article. So actually the first 2 articles, because in Maulana Azad the rotation through pediatric surgery was also there.
Oh, okay.
As a senior resident. So during that time, there were 2 conditions which were peculiar for the children. One was the primary peritonitis, which was killer for the pediatric patients. And the second was the non-specific regional jejunitis, which was not like Crohn's.
Right. This is an acute condition.
It is acute condition. And it is
Sometimes
not
go
like
gangrene and
gangrene, and they perforate, and those
Right.
things, they present with the like feature-like obstruction. So I
Right.
studied some 20 cases and something. I said, this is something. So I talked to my boss that time, Dr. Pediatric surgeon, Dr. Devedi used to be there. So he said, yeah, this is something. So search the literature. There was Yersinia and all that thing, but we didn't find anything. So those were the first 2 articles which I published at that time. and then some case reports. And so I got into that. See, the research.
You started enjoying
I enjoy
academic medicine.
Academic. See, the research part, as far as concerned, even in the schools, I had that mindset towards it. So I remember when I was in that 9th, 10th, 11th phase, we used to have scientific fairs in the schools. So I will definitely prepare some model, something, and this thing. Second thing, I had a very good teacher who was a chemistry teacher, but he himself was doing his physics MSc, though he was BSc, so he used to teach us. So he had a research mind. So I used to go to his house in the evening and read those books which these people used to read for MSc and all that thing, and say that those experimental things which were used to be there. So he used to encourage me. So I said, no, I want to do this. I want to work on it. So I will do something like that. So it was a thing which
now
was
there is something called work-life balance, which is talked about much these days. Delhi is full of social life. Did you ever enjoy?
Yeah. So yeah, this is something with all that thing.
Yeah.
Yeah. So my way of doing the things were different. So how I managed that? So naturally, you are there till 1:30, 2 o'clock in the wards. Then you go for the lunch, and by 5 o'clock you are back in the ward taking the evening rounds and teaching rounds. And I used to enjoy teaching at that time also. So means my all housemen were sufferer because I would ask them round why you do this, why you do that. It's all basic things.
Right.
And by the time the round gets over, it is 9 o'clock. That was the culture in the Maulana. The all senior residents used to finish by that time, 9 o'clock. So if I see that there is some patient which requires a second trip in the night, okay, but that time there were no telephones.
Right.
Call jata tha likh ke, room pe aata tha, and used to be housemen, and there are few nights where the interns used to be in the night duty in the ward, and the ICUs were hardly any ICUs, very few ICUs. So what I will used to do that now, you can't remain awake after getting tired day. At 9:30 khana kha ke, you can't sleep. You can't remain awake. So then I'll go and say, let's go see a movie. Okay, so I have got a Vespa scooter.
Right.
So we will go and go for the second show movie somewhere.
That is social life.
That is social life. Right. And while returning, I'll go to the ward and see the patient.
So to keep awake in the night, you are watching a movie.
So to watch a movie. Because there were no televisions.
That's right.
There were no televisions at home.
Yeah.
So that is the way, and that thing helped all throughout my life. Even in Mumbai, means I will do that. Means not going to the movie, but yes, I will drop in the ward somewhere late in the night if I find that yes, there is patient who may require something and require second ward. So that was the one. Second, yes, Sundays were the day which were lighter, means after the morning round is half day work. So you have friend circles, you can meet them.
Right. So how long were you there in Maulana?
So almost 3.5 years.
Right.
Because my initial appointment was ad hoc.
Right.
The regular appointment used to be 3 years. So that's why it became 3.5 years.
So that will amount to what you are dreaming, that your MS general surgery training isn't enough. I need 3 more years of surgical training. That fitted in well in a high volume center.
Yeah. It fitted well. It made me a confident surgeon. Where I thought, yes, now I'm independent. I can do everything.
And you did academics also.
Yeah, I did the academics also. But Maulana has got that academic department. They had a very good research lab and all that. As a senior resident, we didn't get the time to do that type of basic research, but our lecturers and seniors used to do it. So that was quite a...
was somebody guiding you, because still you are a surgeon in the making.
So I would say Dr. T.K. Thusu, he was our lecturer. He was the first person who used to guide me in getting the surgical skills sharpened.
Right.
There was Dr. K.K. Pandey.
Right.
And then, of course, Dr. Anand Prakash.
Then what happened after
So
Mamsi?
now the thing is, what happened that I never wanted to go in private practice, and somehow I was not interested in going abroad.
Right.
At that time, though I was trained to go to do FRCS and all that thing, I didn't have that mindset. So I wanted to go into the academic job, and that time in Delhi, the job of lecturer used to be advertised through UPSC, and that to be alternate years.
Right.
Okay, the Pondicherry Jipmere was covered in that. So
Right.
Goa, Jipmere, and Maulana Azad were three jobs which used to get advertised. So that year already the post got filled. So I know for 1 year there is no chance for getting any job in here in the central government.
Okay. Okay.
It will not get advertised. So I was looking for the filler. So somebody suggested, why don't you get into private practice? So there was a Narendra Mohan hospital in Mohan Nagar near Delhi. That was only some private hospital, and somebody knew there. So somebody said, you can go and see. I went there and saw 2-3 days. I said, no, this is not my cup of tea. So I said, I don't want to do private practice.
Right.
Because my mindset, like my teacher, he was not doing private practice when it was allowed. And somehow or other I was not inclined to do that. And that is the time one of my classmates, he was a pediatrician, he has moved to Surat Medical College as an assistant professor.
Okay.
About 2 years earlier to me. And he said there is a position of assistant professor in surgery here in Government Medical College in Surat, and they are looking for the people they are going to advertise. So if you are interested, then you can come here. So I said, okay, by all means.
From Delhi to Gujarat?
Gujarat. So the idea was at that time that mindset was that yes, I take academic position, this is assistant professor, which is equivalent to lecturer.
Right.
And but that will give me a time to come back here.
Right.
When the post get advertised, I will apply and see that if I get selected. And because I am a assistant professor, so chances will be more.
Okay.
So that was the mindset. Now in the process, my wife had to take the leave from the job.
Right.
I had my elder son already born in 76, and this was 79, and she was pregnant, so the younger was to born. So she stayed with her parents in Delhi, and I moved there. So there are different challenges. Now you are at a government medical college, Surat, which is not same as Maulana Azad. We are back to Gwalior level.
And a different language.
And different language, a little more than that. But now what I have learned there in Delhi came handy. Because I could manage those things which were difficult things.
Right.
Okay. And that's where the challenges started coming. And one of the challenge came with the portal hypertension patient.
Right.
So the patient with multiple hematemesis and all that thing. And that time only KM Hospital, Dr. Balerao used to do shunt surgery. I have not heard about him at that time.
Really?
Yeah. So this patient came in emergency with the hematemesis. There were no Sangstican tube, there were no endoscopy, nothing. And you have to do something to control the bleeding. So in the books, read the Segura's operation.
Yeah.
Okay. So I did the classical Segura, thoracoabdominal approach.
Wasn't it a scary operation for you at that time?
Yeah, so that's what I'm saying. The Maulana gave a lot of confidence. Means there I have assisted one, Dr. Budraja did once spinal shunt, proximal spinal shunt once.
Okay.
So I assisted that.
Right.
So there was some idea about that.
Right.
And so within emergency, the patient went home.
Really? Yeah.
So that
non-cirrhotic.
Non-cirrhotic, it was EHPBO. But he was bleeding to death, he would have died.
Right.
There was nothing we could do. And young patient, he went home, so that gave the confidence. Then
That'll get you a name also.
that gave the name, and then the next patient got referred electively.
Right.
So that is the time the first spinal shunt, proximal spinal shunt.
Right.
So that's how it started. Then like that time prostatectomy was a common operation.
Right.
And those Freyr's operations I have done enough, but I never liked it, the way the patient has to move around with that those tubes and all that thing, catheters, suprapubic. So because we used to teach, now the teacher job came, and there I have to teach urology also to the students.
Oh, okay.
There were no urologists.
No urology, right? Okay.
You have to do everything.
Ah.
So then I said, okay, why don't we do the Millin's prostration?
Okay.
And now in that medical college there was hardly a diathermy for namesake.
Right.
It won't work. So if you have to do Millin's prostatectomy, how do you control the bleeding from the capsule?
Right.
So that is the time the first innovation came. That I started taking those row of, now that was chromic Edgar was the best suture material.
Right.
Silk was the next best. So chromic Edgar, 2 rows of the suture on the capsule, because that anatomy came in the.
Right.
The vessels runs in this direction.
Yeah.
They are in the capsule.
Right.
If you control them, they will not bleed. So 2 rows of the sutures, tie them tightly, and then incise with a knife.
Okay.
And dissect the prostate out with the Mergen-Baum scissors. And there was no bleeding. So that's how the innovation started. And same time, I found that residents were quite good, the colleagues were good, and so there were articles which were coming about these antibiotic uses.
Okay.
So one of the PGs, I said, why don't you do this antibiotics, the perioperative versus prolonged antibiotic which we keep on giving. So his thesis there. So from there, my antibiotic uses started cutting down.
Okay.
In the perioperative period.
Okay.
So that was the first that thing that happened. So there were a lot of innovations that were going on. Then they said, okay, we are buying the endoscope. The medical director came from Ahmedabad and said, we are buying medical. So I had some exposure to the endoscopy. In Dr. Anuprakash's unit, there was a counter unit, Dr. Mishra, who was a medicine professor but medical gastroenterologist.
Okay.
He has an interest in gastroenterology, so he had an
Endoscope.
So I used to go and attend his session whenever I get the time. So I had some idea, and yes, we should start doing the endoscopy. So we started upper GI diagnostic endoscopies there. But in the mind, back of mind was, I have to go back to Delhi.
Okay.
That was the thing. So it is a.
So you're on the lookout for central government jobs.
So central government job, I was always looking out. But there were no advertisement coming. And by that time, the Gujarat government advertised the post for permanency. So I applied, because this is the only job, I'm ad hoc right now, I have to apply. So I applied, got selected, so became permanent also. By the time my wife, she delivered and she joined, she got into the pathology there. So it is a restarting for her. She's just 1 year junior to me.
Okay.
She was topper from the Lady Harding, but then her career,
OBGYN to pathology.
Pathology. So her career got she suffered in the bargain. So then she would join it, and that is the time suddenly an advertisement came from one of the newspaper in Mumbai. The MPSC advertised the post of the reader in surgery in Bombay Municipal Corporation.
So which is a bigger post?
Bigger post. So it's assistant professor, associate professor. Reader is the equivalent to associate professor. So I applied it.
But you wanted Delhi.
I wanted Delhi, but I wanted.
Wife also wanted Delhi.
Yeah. So yes, she also wanted, because everybody was there. So the thing was that I knew that at Surat I can't progress beyond a limit, because government medical college, and they can't give me that. I wanted to research basic and all that thing, which was not possible. And so I was looking for the position. Then I said, this advertisement is a higher post. Perhaps this will give me a jump to going back to Delhi.
Right.
That was the thing.
Right.
So I applied for it. When the interview letter came, everybody said, you are going to Mumbai, nobody will select you. One thing.
Okay.
You are outsider. I've been to Mumbai very long back when I was in the college. So I'll do some sightseeing and come back. And exactly, I took the night train, got down at the station, Bombay Central Station, went into the restrooms, वहाँ का जो होता है वहाँ पे जाके चेंज वेंज करके फॉर द इंटरव्यू वहाँ से सीधा. So fortunately for the interview, things went almost suddenly. This is again the destiny. What happens? That this is an unknown place, unknown people. There were 8-10 people. Later on, I came to know there was one head of department of general surgery from JJ Hospital, one dean from the BMC, then chairman and the other people. So when the discussion started with the expert, they asked the question. Fortunately, he just started on the talking on the this primary, secondary peritonitis and all that. And I have published that paper on the primary peritonitis.
Right.
So immediately the organism, this, that. So I was fresh. Yeah, this is the thing. This is the primary and secondary. So on that, what the discussion went, he was quite happy. He closed down. Then other few asked few questions, and suddenly one gentleman. Later on, I came to know he was the dean of one of the medical colleges from BMC. He said, you know, we don't provide the accommodation here. So why he is asking this? So my wife is a doctor. We don't give the job to your wife. Because she will do private practice. This is just a spontaneous.
Right.
I have not planned for it.
Right.
So she will do private practice. You know what is the in Mumbai the rents, your whole pay will go in there. So when I said my wife will go in practice, that chairman, he started laughing. He said, go. I came back within 7 days. I got the letter that I have been selected.
Right, wonderful.
So this is just a destiny. It was not a planned thing. I applied. Never expected that I will get selected.
Now, if I can interrupt,
Yeah.
you're a rank outsider in Delhi,
Yeah.
a rank outsider in Gujarat, a rank outsider in Mumbai,
Yeah.
and you got selected everywhere.
Yeah. I think
It's a fair country.
It's a God's grace.
Fair country
God's
at
grace.
that point of time.
Yes.
Fair
God-
selection.
Yes, fair selection. And so, thing is that when I came back and when the letter came, so I talked to the people. Some people say, so by that time it was almost 2 years, more than 2 years in Surat. So I was getting well established.
Right.
And then people say, Surat is a rich place. So they say, why don't you come in the private practice? You will make money like anything. You can have your own hospital and everything. And you have made already good name here.
Right.
So there is no problem for you. And in Mumbai, you will be a ocean in the drop.
Okay.
That was clearly told.
Right.
So again, how the destiny happens, that I submitted my resignation. I made up my mind, yes, I am going to Mumbai. Submitted my resignation. Then somehow other mind changed. Okay, what I am doing? These people are also perhaps right. Why I am unnecessarily want to struggle in a new place where I don't know anybody. And I withdrew my resignation. And there was a lecturer in the radiology department, Makwana, I still remember. So when in the beginning things were getting discussed whether I will go there or not there, so he was a palmist. As a hobby. So he's on my hand one day, he said, you will go to Mumbai. So I went to, after withdrawing the resignation, I went to his room and I said, I have withdrawn the resignation, so your prediction is wrong. He clearly told me, he said, wait and watch.
Really?
Really. And it happened that after about 20 days, I resubmitted the resignation. So this is what again the destiny comes into picture. I walked into that medical college which I dreamt of studying. Now this is something, a story which is going backward. When I stood first in the university in the BSc Part 1, I wanted to study in the best medical college in the country. Again that, you can say the kida in the mind, the worm. So I wrote to, that time in place like Guna district, okay, you don't have much of means. So I found out yes, Madras University is the one best university, Calcutta University another, and Bombay University. So I wrote 3 universities. Writing that I'm interested in getting into the medical school, let me know the things. So from 2 places, Chennai, that time it was Madras, and the Calcutta, no reply came. From Bombay University came, our admission process already over. Can't get in here now. So the day I got appointment in GS Medical College, I said, see, this is the place where I wanted to come and study, and today I am getting one.
You very strongly wish it will happen.
Yeah, you can say that. Means I have forgotten about my own wish till when this happened. So that's how I landed there.
Sen, but you grow wherever you went, you grew. And what was the growth in?
Yeah. So see, the thing is that when you are coming from a smaller place and going to bigger place, one of the thing is you have to prove yourself
Right.
equal to them or better than them.
Right.
Otherwise, people try to trample on you.
Right.
I've seen this in Delhi also. People tried it. Means the postgraduates will also try to test your knowledge.
Yeah, right.
Okay.
That's why I asked you, isn't it a cultural shock?
Yeah, so they do try, but somehow I could manage
Now,
them.
if I can use the word matlabi,
Yeah.
they used to tell me that you are from a very sort of simple place like Madhya Pradesh and you go to Delhi, log are matlabi. In sense, they'll see how their benefit, they are not bothered about whether you are benefited.
Yeah.
Did you experience that?
Yeah, so you have to prove yourself. See, the thing is, you have to prove yourself that you are better than them.
Right.
And for that, you have to work hard.
So you are ready to take the challenge.
So I took the challenge. See, I think inherently I had my confidence.
Quite
that I can-
often, with a simpler background, people will chicken out. No, this is not my cup of tea.
Yes. So see, you look at this way, then when I moved from Guna to Gwalior, now Gwalior was again the local students.
Right.
Some of them I studied from Sindhia school, others better schools and colleges in Gwalior. And I am coming from a village background.
Right.
Okay. So first thing is the language, because till now, up till BSc Part 1, before that, everything was in Hindi. So how I overcame that? When I went into 9th standard and I decided I want to study the medicine, I knew that if I studied all these books in Hindi, when I come to BSc Part 1, I will have a lot of difficulty. And when I come to the medical college, it will be further difficulty because everything is in English. And so I went to a place known as Ujjain, where there were a lot of publishers and the books there. And my so-called grandfather was there at that time.
Okay.
So I went there and purchased the books which were in English,
Okay.
covering the same curriculum, and started studying them at home. School mein it was all Hindi. Then I will translate all my Hindi botany, zoology and all those books into English and write the answers in English.
Right.
So 9th standard onward, 9th, 10th and 11th, I will write all my answers not in Hindi but in English.
Right.
Now spoken English was a problem,
Right.
because nobody used to speak English. So I used to practice a little bit here and there. And that was my weakness, because I was not convent educated. So that was one thing which came as a barrier in Delhi and Mumbai also, that you can't be that fluent as the people who have studied in the convent. But I think it got compensated over a period of time.
So where did you come across Dr. Balarao? Did you come in contact with him?
Yeah, so he was the head of department at GS Medical College.
Really?
Yes. So I remember that when that patient which I did that devascularization, severous operation, afterwards, because that family decided to go for a second opinion afterwards, though there was no bleeding and all that, just for sake. And Dr. Balrao's name was known to them, so they went there. And he came back and he showed me the paper. He said, he told that, who operated on you? It's a wrong operation. I know, that the vascular procedures are always criticized by all these stalwarts.
I know.
Option. Huh?
Yeah.
they never liked it.
Yes.
So it was a very bad remark.
I also thought it's a damage control. It's not the conventional operation,
yeah.
especially non-cirrhotics.
Yeah. So that's what I proved wrong ultimately.
Yeah.
So that's a part of him. Yes, initially when I got selected and went to meet him, when I decided to, so it was little cold reception.
Yeah.
That outsider coming. That was a general reaction that why an outsider. So when I joined, ultimately, I think the dean of that college was very good. I was just, I think, how much I was, 32 that time. And he said, I don't have accommodation and this thing. So before joining, I should know whether I can get it. He said, no, you will get it. So one bedroom apartment. I was used to in Surat living in a bungalow. Okay, fine, whatever you are giving me, it's fine. So I used to travel by bus to the work. And all that. So it was a cultural shock, and you are always under observation, coming from outside, what is your level. But that also motivated.
No, but this again is a stopgap for you. Delhi was on your mind all the while. At what juncture you thought, okay, this is my place?
So I think, so I joined there in 81 Feb, GS Medical College. And I think 2-3 years I was quite well established there. Means I gained the confidence of the students, gained the confidence of the other departmental colleagues, that people, the doctors, they started coming to me for surgeries and all that thing, which was not liked by the local people, the stalwarts of there. And also I started doing the endoscopy. Now the endoscopy happened there as an accident to me. What happened that general surgery department had all the 3 endoscope, colonoscope, and ERCP scope and the forward beam. So and it was all fiber optic, D3, D3 and that series, Olympus. And there was one guy who used to do the upper GI endoscopies. But then the endoscope used to get spoiled every 6 months, fiber broken and this. So after about, this was in 82, about 1 year, when Dr. Balrao observed me that yes, I am a sincere person and have knowledge and all that thing. Then one day he called, he said, will you take charge of these endoscopes? But I want you to develop both colonoscopy, RCPs and this thing. And the condition is that you have to train the juniors. And the endoscope should not get spoiled.
Okay.
Now you train the juniors and endoscope don't get spoiled. And there was a lecture scope. There was no video and all that.
No side attachment for student.
So that was just a lecture scope to students to teach them. I took the challenge. So I started the diagnostic upper GI endoscopy, then started doing the ERCPs by 82. Colonoscopy. ERCPs.
Oh, right.
And colonoscopy. So first pulpectomy there, it was not medical gastroenterology department, I did.
Wonderful.
And I started teaching them how to do it. And then, so
Dr. Balerao, Dr. Nandi always used to talk about Dr. Balerao, that he is eccentric. He did attempted liver transplantation and he did foot left-hand surgery, and is much beyond his period and time. I mean, was it true?
Yeah, it was true. See, he was basically, he did so much of research in the liver failure, liver functions.
How did he get it? He was trained abroad, or
yeah, he went to the Commonwealth Fellowship. He was trained abroad. So when he came back, when he came back, that was in 68 somewhere, the atmosphere in KM Hospital was different. There was a head of department full time, Dr. P.K. Sen. And he was a very forward looking person. He had been trained in US. He was a cardiac surgeon.
Right.
So first thing, he started developing all the super specialty.
Right.
When nobody, so though he was general surgery director, he separated out. He said cardiac surgery with him. Then Dr. Porulkar was his other student. And then he developed the urology. So separated out the person with the urological interest. He said, you say take separate department, pediatric surgery, separate department, plastic surgery. So he gave the people the space to develop their departments. So he was instrumental in encouraging Dr. Bhalirao also to, because his interest was in liver. So Dr. Bhalirao used to do a lot of research. When he used to see, he started portable shunts and all that.
Right.
And then when the Warren shunt came, 67 onwards, he started doing Warren shunt. So he and Dr. Basu, late Dr. Basu in Calcutta.
From Calcutta.
So Dr. Basu was...
He's a cardiac surgeon, Dr. Basu.
No, Dr. Basu
Thoracic.
was the liver surgeon.
Right.
Again, portal hypertension surgeon.
Right.
So he was in Calcutta and Dr. Bhalirao here. So he was, I think, senior to Dr. Bhalirao also. He was senior to Dr. Bhalirao also. So he also adopted from portable shunt to Warren shunt.
Right.
At the same time, and Dr. Bhalirao started doing.
And you are working under Dr. Bhalirao?
No, I was not working under Dr. Bhalirao. I was working in another unit.
Okay.
So Dr. Bhalirao didn't give entry to me to his unit. So
why
no
competition?
That figure was a feature that I was outside.
Oh right, okay.
So that we gave me the good unit. The unit chief was good, nice person. Again, Dr. Bhalirao was just 1 year junior, so senior people. And so that is the time. So he used to do a lot of shunts. And he used to do a lot of basic research. He worked on the acute liver failure.
Right.
Galactose clearance test and all that.
Okay.
He used to do BSP clearance test to assess the liver function test.
Right.
He used to do liver sections and all that. So he was much ahead of the thing. So he did in 1970 the first liver transplant attempted from the non-heart beating cadaver. So that is the time. 68, Dr. P.K. Sen did the first heart transplant. They were second in the world after the Christian Bernard.
Right.
They didn't survive because naturally...
Even liver transplantation, 67 is that the period when the initial transplant started.
Yeah, 67 was the Stargell's first successful transplant.
Right. And a year later, Roy Khan, Dr. Roy Khan.
In the 70s, he was doing it. So the thing is that
so the Western India is ahead of the rest of the country. Yes, not Delhi, not Calcutta, not Chennai.
That time in medical field, Western Mumbai was far ahead of the Delhi.
Right.
The Delhi people used to look upon as this thing. These people are special.
So you reached the right place, right time.
The right place, yes. Perhaps. Calcutta medicine was also was advanced. That time means portal hypertension surgery was only in Calcutta and Mumbai. And some was Dr. Rangabasham and all these people. So these three were the main places where the advancement in the medical field used to happen. Madras Medical College, and GS Medical College, and the AIMS was picking up. AIMS was already picking up, and the Calcutta. So that's where what happened that time, the endoscopy sclerotherapy reports started coming, articles started coming about its efficacy, particularly in emergency for controlling.
Right.
And Dr. Bhalirao used to do emergency shunts and all that thing. But they didn't believe in that devascularization procedure, like Dr. Nandi didn't believe. So these were all people who never believed in the devascularization procedure. They thought. And Western criticism of Segura's operation.
Right.
Like the Western articles.
Highly morbid procedure.
And not only that, if you read the good outcome of Segura's operation of that time when they published, you read the articles with the Western, what they will write on that, editorials, they say in the Japanese cirrhosis is for the Japanese, by the Japanese, and they can treat by devascularization.
Okay.
So this operation is meant for them, not for the Western world. In Western world, because they were doing a very limited devascularization and they were getting bad results. It want to happen.
Okay.
So he used to do light, but then there was a high mortality because if you do cirrhotic child C patient in emergency portable shunt and all that, they are going to die. So mortality was very high in the shunt surgery at that time. So that is time when the sclerotherapy came. So he then called me, Mathur, you are doing endoscopy now, you should start sclerotherapy. I said, fine, we can start sclerotherapy.
There was no gastroenterology. No.
Dr. Nayak had just joined, SR Nayak.
SR Nayak in Mumbai.
So he was in PGI Chandigarh.
Right.
So he was picked up by medical head, the late Dr. Vienacharya, she knows somewhere, and he came. So he came as a medical gastroenterologist. This was 82. So he joined. Now, PGI Chandigarh didn't have much of endoscopy thing at that time.
Oh, really?
Dr. Delavri and these people were there, and very select people used to do. Junior people were never allowed to touch the endoscopes. So here I was one who was already doing everything.
Right.
So, I said, where is the exclusant and where is the needle? So he said, okay, I will arrange something. So some person was coming back from US. So Olympus 1 sclerotherapy needle and sodium tetradecyl sulfate exclusant.
Okay.
30 ml bottle. So first case, and he said, do it. I have only read in the book,
Right.
not seen. So he said, don't worry, I am here. I will operate. So I did my first endoscopy sclerotherapy, bleeding esophageal varices,
Right.
and bleeding got controlled.
Right.
Everybody
Is
has.
it in the annals of India that the first time that
So
was done?
I don't know. I think so. So whether the AIMS people at that time, Dr. D.K. Bhargav,
Yeah.
he was the one who has started. G. Pante was nowhere because they didn't have that.
Actually, Dr. Bhargav is the only person doing this endoscopic intervention for varices that time.
So I think I can't remember exactly.
Must be doing same time, more or
this
less.
was September 1982. I remember that date when I did
I
the
think
first.
Dr. Bhargav did in 84, 83, 84, or maybe 82.
So after that, what happens that in 83 there was the ISG conference in Hyderabad, and Dr. Balerao and all these people. I think I did 82 or 83. I would recheck it. Okay. So these people have gone to ISG conference, and his patient came with the variceal bleeding, and some other patient. So he called up. He said, "Do the sclerotherapy in the night." Yeah, okay. So I had my assistant, and who was my registrar, Parulkar, who was son of the dean of the college.
Right.
Nice person. So we injected. The bleeding got controlled. So what used to happen? These are the metallic thing.
Right.
You have to push and pull.
Right.
Okay. Now, if you pull too hard, the whole thing can come out. It is a metal sheath, and there is a Teflon tube going on.
Right.
And they are very complex. Ron Paska jo sclerotherapy needle was a very complex system. So last injection given and remove the needle. He pulled it, perhaps ज़्यादा force से everything came out. So the sclerotherapy needle got spoiled.
Right.
And it was an expensive thing. KM didn't have.
And bleeding is increased.
No, bleeding. No. What? See, that bleeding was controlled. It was only, see, when you withdraw, before withdrawing the whole needle through the channel of the
into
endoscope,
the sheath and then take it.
You would retract it into the sheath.
Right.
So that the endoscope doesn't get damaged.
Right.
So I said, retract. ज़्यादा force लग गया, whatever happened. So it came out. He was very tense. He said, Dr. Baldra will now take me left and right. He is spoiled. I said, okay, don't worry. I talked to him when he came back from the conference. I said, now this is over. That 30 cc is also over.
Right.
What next? So he said, no, I think you should, let's develop something. You do little reading and search for something. Okay. So then suddenly it happened that we used to use phenol and glycerin
Piles.
and phenomenal and piles.
Yeah.
Okay.
Vegetable oil.
Vegetable oil and all those things.
Right.
And that was a very common thing.
Yeah.
I also do the bending and all those rectal
Right, right.
varices. So, not rectal varices, piles.
Piles, yeah.
So I said, yeah, so let's do. So I went. So I said, when the phenol can work here in the piles, they are also like piles only, varices. Right. Why it will not work here? There also we do it. Then I went through the literature. I found a German article where they use phenol in almond oil in the varices. Esophageal.
Right, okay.
I want one this thing. So I went with Dr. Patta. See, we found one article which says it is used for the esophageal varices. He said, but we can't use it like this. Let me design a clinical experimental work. So that is the time I did the experimental work in the dog's veins.
Right.
So that time the Sarine started talking about the absolute alcohol by that time.
Right.
Okay, and there was ethoxychlor करके आता था, STD करके आता था. So then I procured sodium tetraethyl sulfate from somewhere. We had absolute alcohol and 3% phenol. We got it prepared in the pharmacy. So then I said,
how will you sterilize it?
So they autoclave it. And phenol itself is a antiseptic.
Right. Yes.
So that is the time. So we did the vein. So in the same dog, multiple veins, inject with the alcohol one, inject with the STD one, inject with the 5% and 3% phenol. Because piles we used to use 5%.
That's right. Yeah.
So I said 5% will be too strong there. So let's try it whether 3% will work. I don't know why the mind made 3% higher. So we used that, and then we saw after a week those veins what happened. Then 2 weeks, 3 weeks.
I have a question here, so if I can interrupt. Like when you have to inject phenol vegetable oil through the Higginson syringe for piles, is very difficult to inject. How will you inject endoscopically into diesel varices?
Yes. So the needle which is required, 18 gauge needle.
18. It will puncture the.
So first we did this experimental work. We excised those veins at different intervals, did the histological examination to see what happens. And we documented with the phenol, there was a sclerosis. So by 3 weeks, you get the full fibrosis in the vein.
Really?
So initial thrombus, then inflammation and this thing. So we had serial this thing. We had absolute alcohol damage and the STD damage.
Right.
Okay. So we proven that yes, absolute alcohol causes a lot of necrosis of the skin around. This doesn't cause, STD doesn't cause, but it is as effective as STD.
Okay.
So that was the first experimental work we published with the phenol in oil. And first 50 cases of sclerotherapy I did with the phenol in oil.
Okay.
Sclerotherapy. Now the D3 was a big endoscope. Its channel was big, 2.8.
Right.
So there used to be a washing tube which used to come with that endoscope. So now how to make the needle? So what I did, taken the 18 gauge LP needle, cut the tip. Okay, tip was fixed in the front of the tube, and the back was fixed in the back of the tube.
Innovation.
And
if the tip remains there and doesn't come with
fixed properly, the size will match here. So we use that. Now, trick was that endoscope should not get damaged because it's a bare needle going through the endoscope channel.
That's right. Yeah.
So you have to very carefully pass it. This assistant has to be very careful. And we did 50 cases, sclerotherapy, emergency and elective, and it worked. But then my assistant, what you were saying, now by the time medical gastroenterology also became in. So they say, sir, hypertrophy हो गया सबका, इतना force लगाना पड़ता. So that was the thing. Then I said, no, this is not right. We should find out whether phenol can be mixed something. And then I went to the Goldman-Gilman pharmacology book.
Okay.
To find out if the phenol is mixable with anything else.
Oh, right. Okay.
There I found one reference that phenol is also mixable in the water.
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 Okay.
So then another set of experimental work.
Right.
I got the pharmacy to make the phenol in that oil and phenol in water.
Right.
Same percentage injected in the dog vein and found it worked.
Okay.
The moment that aqueous solution got ready,
then it's become easy.
Then you prepare the normal retractile needle, sclerotherapy needle, fine needle.
Okay.
So then I started.
This was published.
Yeah, this is all published.
Because I remember those days where we had to get vegetable oil. It is available in Spencer's pharmacy in Chennai. Only there. We had to write a prescription and give. That you made yourself?
Yeah, so about pharmacy was very good.
Right.
So they used to prepare it.
Okay.
So that phenol in water, when they started preparing, the total cost used to be 2 rupees, out of which I think 50 paisa was the cost of the phenol and 150 was the cost of that amber colored bottle, because it has to be that photo
protected.
Photo protected. And they will prepare it and sterilize it and send it to us, and so we did more than 1,000 cases of sclerotherapy. So that's how, and that's where the whole emergency shunt surgery, elective shunt surgery went down in the KM hospital. And then only for as a rescue surgery, that's where then by the time Dr. Bhalera retired, when he's gone into private practice, I took over his unit and I brought this Siguraj operation. So I decided to do the modified. So I said, see, Siguraj has done 2 stage this and all that thing. What he wants? You want to go up to inferior pulmonary vein. I used to do transhiatus esophagectomy for cancer. Because see, when I can do transhiatal esophagectomy, I can do the devascularization also transhiatally. That is the time that thought process came. Why to open the chest? That adds some morbidity. Okay. Then came why do the splenectomy? Why not to preserve it if in case this doesn't work later on you can do the shunt surgery. For emergency, doing a splenectomy also takes time and blood loss. So that's how the modification started coming, and then I standardized the modified whole procedure abdominally, and that time there were no Thompson retractor. So I will take the reverse Doyne's retractors, okay, put them and tie with the tape to the these poles of the anesthetic saline stent to give the retraction. And so when I started doing it, slowly I realized that it is working well, and then the long-term results started coming.
We remember Dr. Nandi et al. 92% 5-year survival. Immediately SK Mathur 88% 5-year survival. It's Sugiura operations. How can this happen? We always wonder, because I was with Dr. Nandi for a long time. Then that's a comparison, and you're almost there. So many other advantages you had with this procedure.
So it started, got innovation for the emergency surgery as a rescue, and then I taught all this, and then I said any general surgeon can do it. It doesn't have to be a special portal appendage surgeon with this.
How was it that Mumbai portal appendage was so much? Is it because you are working on it that you got referred?
Yeah, referred. All over Maharashtra the patients used to go.
So actually, frankly, I should admit my lack of knowledge that I didn't know that you are so much into endotherapy. You're a pioneer of endotherapy for portal hypertension. I thought you're a surgeon. I don't know how many people know that.
So we published our then long-term results of endoscopic sclerotherapy, 300 patients. 300 patient series in gastrointestinal endoscopy. And then all this experimental work which we did means even to prove that this sclerosant is safe for the human beings. So the patients who used to die, not all patients can be saved. Some of the patients
cirrhotics
So the autopsy was very good pathologically. So I used to go and tell them to excise the esophagus, जिसमें sclerotherapy किया, and then get the histological examination, see in the veins what happened. Has the phenol worked? To what extent? How to change it? What I demonstrated in dogs, I could demonstrate ultimately there. And they, fortunately for me, means we had like 1 week, 3 weeks, 6 weeks. So how the veins get obliterated. So all that got documented. We published the morphological changes.
Who were the students, your students at that point of time?
So initially it was
who made it big later?
So one is Sudeep Shah.
Sudeep Shah is your student. Okay.
But he came later on when all this was well established. When I was doing all these things, Abhay Dalvi was the one. Drais was there. And Balchand Kulkarni. He is a very intelligent guy. He is in Nashik. I say he is a loss to the surgical academics.
All those people came in search of you, or it just happened?
It just happened. Means some of them just in search of me, but they were all.
I mean, you have a great chief, you get inspired, obviously.
But my unit was, because what happened that when I started doing endoscopy, so my thing was emergency endoscopy for bleeders. It was not wait for next morning. So I used to come down in the night. That Dr. S. Nayak also, so we used to do alternate day call.
Right.
So if there is a bleeder, in the night also we'll come. So it is a variceal bleeder or duodenal ulcer bleed where you will come.
Right.
I started injecting duodenal ulcer bleeds also
Right.
to control the bleeding. So alternate night we will be on. So my unit was all on call every day. Officially, general surgical unit was once a week. Okay, because there were 6 units. But because of these bleeders and emergency endoscopy, they were on call every week. So they all used to suffer. Means.
Now you started liking Mumbai.
So, yes, sort of I enjoyed my work. I enjoyed my work.
So you're not thinking of Delhi anymore.
See, until 84 I was still thinking. 84, then 87 also, 86, 87. So there were 2 opportunities. In 84 what happened, there was a post advertised in AIMS of associate professor. I did apply because I was already associate professor, so it was a parallel post for me to go. I came to know later on through the people, I won't like to name them,
Right.
not proper, that yes, I was selected, but then they decided to keep the post in abeyance. But that is the way the AIMS works for so many things. The second time it happened that when the Dr. S. Nayak, he shifted when the SGPGI Lucknow started. Dr. Nayak was the one of the architect. He went right in the beginning, and he wanted me to come with him because we became very friends. Means my GI surgery hardcore, he was instrumental in pushing me in that.
Why did you go?
So what happened that by the time my children were in the school, okay, their career was getting built up. My wife was also already a associate professor in microbiology. She did after gap she did the MD microbiology there. So that's the hard part for the family.
Right.
For her to, after 10 years gap of MBBS, pass the MD exam, then start the career. So she was well established. And again, it's a destiny, I feel, because Dr. Nayak, I did apply. Dr. Nayak said, you apply at least. I see, I will apply, but I will not come for the interview. Because the stakes are too much. Because I knew that here they will take it against me in a different way.
Right.
Because there is always a jealousy and there is problems. So I didn't want to do that. And if you can consider me in absentia, then fine. So then say, no, we can't. Okay, fine, thank you. But that's again a destiny. But I was involved with their whole curriculum setting. I was a member of their board of study. So as a matter of fact, endoscopy, I recommended that GI surgery training the endoscopy should be part of it. And Dr. Nayak accepted because he saw that I have trained all of them. So he accepted that, but the other people objected.
Sir, Dr. Nandi has got a British background. Is educated, born, brought up there, and whatever methodology, discipline he got from there. Dr. Rangabhashyam is UK trained, and he's got a certain methodology. You are purely an Indian born bred. How did you get the discipline? How did you get the methodology? How was that students got attracted to you? Where did you learn that?
Yes, means some people feel that it is a deficiency in my training.
No.
That way. No, I'm not talking. See, the thing is that, yes, I'm a self-trained person. You can make out that.
Right.
Till that time. Okay. And a desire to do something new. A mind to do the innovations, lead to the research. My motivation was when I was managing these patients in KEM hospital, poor patient who can't afford. We can't afford the technology. We have got a diathermy, not even our valley lab. We have got a ordinary Indian made diathermies, and you have to work with that. You have to do the liver resections without CUSA and without any Thompson retractor and all that.
Right.
My desire was that I don't want to do inferior work than anybody else in the world.
Right.
Not in India. So if I'm reading the articles from abroad that they have got 5% mortality in Whipples and there is 5%, less than 5% mortality in liver resections, I must achieve that. That was my aim. Now how to achieve that? How to overcome the adversities. And that used to lead to these innovations and the research. So question comes to mind, what to do, like phenol, what to do.
Right.
Okay, sclerotherapy, how to start.
Right.
So phenol came into picture, and it helped all the poor patients, more than 1,000 patients at that time done. They are happy. Means my patients of that time are still following without recurrence of varices. Means it's almost 30 years. So same with devasculation procedure, 20 years, no variceal bleeding. So thing is that now when I used to think and try to do something new, my resident used to see what is happening.
Right.
Okay. My thesis topic for the students was never the case study of this, case study of that. I used to tell them, okay, if you have to work with me, you have to do some original work. I don't believe in this, analyze this, copy in that. So go, you choose the topic, 4, 5, and then I'll approve.
Right.
What is feasible under our circumstances.
Right.
So, as a matter of fact, in KEM when I joined, 81, I became PG teacher immediately because of my all the teaching background in the past. So, my first student was a South Indian. She's, I think, settled somewhere in Germany now. So, she came and she was quite enthusiastic, and she said, sir, I want to do something. So, that time we came, the gallstones were not very common, cholecystectomies were not common.
Right.
But why don't you analyze the gallstones? Simple thing. She said, yes, sir, let's do it. So, we will do. So, her father was scientist in the BRC.
Okay.
So, he says that my father is there and his colleagues are there, so they can do the analysis. Okay, so we read the article, and that is the time I gave a topic of analyzing the gallstones by 4 methods: spectroscopic, electron microscopy, chemical, all these things. And she did. It was a fantastic job. She published it. As a matter of fact, Dr. Rakesh Tandon, who was the medical gastroenterologist, he was not head at that time in gastroenterology.
He was. When I was there, he was.
Yeah. Later on, he became head of department. And this was his topic, gallstones. He had done a lot of work.
Right.
So when he met this PG, when she presented the paper in ISG, he was very damn impressed with what it is.
Right.
And that is the time. Now, when she took this topic and started working, the people in the department and some of the seniors told her, what are you doing? Everybody just does some study and copy paste the previous dissertation. Why you are doing this? And Dr. Mathur is a new person, he must be a mad person. She's giving you such a topic. She came ke sir, sab log ye keh rahe hain. It's up to you. If you have a conviction to do the job, you do it. If you don't want, I'll give you the simpler topic. But she was motivated. She said, no, sir, I will do it.
Right.
So, I think you have to, not to force the people to do the research, you have to stimulate them.
Right.
And make them think, yes, it is something which can be done. And that's why they all started liking these things. The small things you keep on giving them.
So by then you become a name in the gastrointestinal surgery, portal hypertension being the main area. Now then that's when there is no any specialty or an organization pertaining to how did you get into, and who are the people you got aligned with before starting an Indian Association in Surgical Gastroenterology?
Yeah, so my alignment, of course, Dr. Nandi, I used to come to AIMS and he was very kind to invite me to the department at that time. Yeah. So his interaction with him, Dr. R.C. Arenia, who was at G.V. Pant Hospital. Dr. Kaushik, I came in contact once he joined the SGPGI.
Right.
Dr. Rangavasham was the main person. Dr. Rangavasham was the main person because when I joined KEM, my chief and Maulana Dr. Anand Prakash, he was very friendly with Dr. Rangavasham. And we met in the ASI conference. That time, initially I presented a paper in the ASI conference.
Oh, right.
When I was in Surat Medical College, we presented in this thing. And Dr. Rangavasham unit always used to have papers in every conference. So I got introduced to him, and somehow that he developed liking for me. So he was a big encouragement for me.
Right.
In everything.
You rose to become president of Indian Association of Surgical Gastroenterology.
Yeah, so with Dr. Chatterjee, Dr. Arenya. Dr. Arenya was the motivator for ISG under ASI. We were all the founder members.
Right.
Of this thing. Yeah, I think you should know that I never fought an election because I am against the elections.
Really?
I'm basically, I believe in the professional bodies. They should be run professionally, not through the election politics. And most of the elections bring the politics.
Right.
So I told them, I will not fight. If you are by consensus, everybody wants me to present, I will become president. That's the way. That's how even for IHPBA, same thing goes.
How did you get into liver transplantation? Because your contemporaries haven't really got, and they're not as much involved as you are at this stage of life.
Yeah. So what happened that once we started managing portal hypertension, the cirrhosis, and as I told you, Dr. Balrao has done a lot of research on the liver failures and all that. So that stimulated me also into that. So I realized that cirrhotic patients, whatever you do, they are going to die.
Right.
You can prevent the sclerosis, control the bleeding and all that. You can't prolong their life.
Yeah.
And that's where I read about the liver transplant and all that things. I think this is the solution finally.
Right.
And this is what I want to do.
Right.
Because if I have to treat the portal hypertension, I must treat completely, not halfway.
Right.
Not as a palliative means. EHPV is different.
Right.
EHPV doesn't require that. So that is the time the mind started working on. So it was in '84. That was my first trip abroad.
Right.
I've never traveled by plane before.
Really?
So, and that is also in '84 what happened that I wanted to learn the advanced techniques in the endotherapy, ERCP stentings and all that thing, and also wanted to see some liver transplant, some exposure, not as a training. So Dr. Nip Sohendra, he is one of the friend, Rainer Karke. He has visited Mumbai.
Okay.
And he came to KM hospital.
Okay.
And we interacted, and he also used to do ERCP, so he demonstrated something
Right.
and showed me the tricks and this thing. So he said, you come, you are already doing it. So you come for 2 weeks with Sohendra. He has got a huge workload. It was daily ERCP stenting and all that. You come there, spend. So that was my first trip. So
Okay,
for 2 weeks I went there, and on the way back, so that time, which name came to my mind? So Germany, Pichelmeier, Hanover.
Right.
So I took my ticket like this, Hamburg, and Hamburg, Hanover and Mumbai.
Right.
And so...
But Nirsa was into fundal varices by then.
no, Sohendra was not into the fundal varices by that time. He was more into the stentings and all these things.
Okay.
And I took my sclerotherapy work, phenol wala.
Right.
So first he laughed.
Right.
He said, what phenol you are talking about? Reaction. But he was, when I showed him the histological slides and everything and the results, so these are talking '84, but then I have not published the clinical results.
Right.
He was very impressed. As a matter of fact, in '85 he came for Chennai ISG conference.
Okay. Yeah.
And from the podium he announced, I have seen Dr. Mathur's this thing and the phenol works. So everybody was taken aback.
Right. Yeah.
So from there, so I corresponded with Professor Pichelmeier that I am going like this. I want to visit and see some liver transplant. So he said after finishing that you drop in. So I stayed there for 4 or 5 days in Hanover. He made the arrangement. He took me for the rounds. Liver transplant didn't happen at that time, but
Right.
they used to do major liver resections for tumors and all that thing. So I attended one of that. And he gave me his own papers at that time, published all the liver transplant results with his signature. I still kept it.
Okay. Yeah.
So that was the trigger. Yes, I want to do it. So when I came back, I said, what to do, how to learn. So I started doing animal experiments. So the dog was free available for BMC.
Right.
And we have a very good dog lab. Because
Right.
all these people, as I said, Dr. PK and Dr. Bala used to do a lot of dog work, experimental work.
Right.
So, and I also did a lot of these things there. So I started doing the liver transplant in the dogs. So
right.
2 dogs anesthetized. We'll remove the liver from one dog, put it in another dog. They never survived.
Right. Yes.
So some of my housemates, they still talk about. So some dogs used to survive till next day. There were no immunosuppression or anything. There was no blood match also.
Right, right.
So it was technical thing. So in the evening round, the houseman will go to the dog lab because it was in the same building on the top floor. We'll see the dog whether he's alive or not in the night. So you should see, we have to take the round and inform you about the human beings as well as the dog. So that's we kept on doing that work. And then I was looking for the opportunity to go for the proper training in the liver transplant. And in '85, I applied for the Commonwealth Fellowship. Now this is something which again is destiny and setbacks, you can say.
Right.
So I applied for a Commonwealth Fellowship, and I got the letter that yes, it is sanctioned. They say if you submit which center you want to go and what is your project. So that time Roy Khan's center was the best center. So I said I want to go to Cambridge, Attenborough Hospital, and the project which I wrote was, I thought that time there was no brain death. Nobody was talking about brain death in India. So how will I do the liver transplant even if I go for training?
Right.
So then I thought, we talk of the segmental anatomy of the liver and all that. Why can't we remove part of the liver and transplant?
But that time,
human,
there's nothing of that nature.
Nothing of nature.
Right.
Now, problem is that with the dog's liver is not divided into the segments like human beings. But the pig's liver is.
Right.
And I knew Roy Khan was doing a lot of experimental work in the pigs. So I wrote a project. I want to learn the clinical liver transplant. At the same time, I want to work in the lab and do the segmental transplant in the pigs.
Right.
Because that will pave the way for doing the living transplant, because after coming back, I can do the transplant.
Okay. That was thinking ahead of times.
Yeah. So by '86, when the results were to come, I got a letter that your fellowship has been cancelled, your project has been rejected.
Right. Okay.
Fine. So opportunity gone. There was nothing in hand. So a little depression, because I didn't have a financial means to go myself.
Right.
I couldn't leave the job
I know.
and go. No, that was the big thing for me.
Right.
So then one of my colleagues, he suggested, why don't you apply to the French government? They also have fellowships and all that thing. And so the name of Henry Bismuth came. Naturally, he was a big name.
Right.
So some contact was there. There was a French lady gastroenterologist who used to come to visit Dr. Nayak's department. So when she
Sheila Sherlock.
No, not Sheila Sherlock. This was Odile Wanchel, French. So when she came next time, and she saw our work, endotherapy and all that, she used to part of our rounds, and so she said, okay, do one thing. I will speak to Professor Bismuth. I know him, and you try to apply and see if he can accept. So I wrote to him. He said, yeah, you can come for training. Then I applied for the French government for fellowship. Fortunately, they sanctioned it. So that was so I went in '89, October.
To Bismuth's unit.
Bismuth.
Right.
So now the problem was that leave was limited. They first they said without pay leave. Then fortunately there was a commissioner who I convinced that it is as per rules you can give the deputation leave. So he sanctioned that. So I went there. It was 6 months because beyond that they said we can't give you the leave.
Right.
Okay, at least 6 months I will get something. So I worked with him. I worked like a registrar. I was already professor here. I was leading the unit. And so I went there and I said I have to learn everything of the liver transplant because I had no backup. So I used to observe the anesthetist. I will learn discuss the anesthetist, what anesthesia, how you're managing this thing. Okay, surgical also. I'll go in the ICU also, post-operative round, pre-operative workup and everything. So I spent like those 6 months where I grilled myself like a registrar.
Right.
Properly to learn every aspect of the liver transplant. But I also thought I should also go to Stargell.
Srazil.
Okay. So that's the time I got another scholarship sanctioned by Hargovan Fellowship in Mumbai, and that was for 3 months. So I wrote to him again. Same Kida Dimag mein worm that can do the partial liver transplant. And I knew he also had a good labs, and he himself used to do so much dog work. I wrote to him that I want to come and work in the labs, and apart from clinical work, and do this type of work. So I got a letter from him. You are most welcome to come and learn the clinical this thing. We have got a busy unit and this. He used to do at that time 400 liver transplants a year. But I don't believe in this split liver and reduced size liver and all these things, and our labs are busy in the meaningful research. So if you are looking for this, don't come here. But if you are looking for the clinical this thing, you come. So I said, okay, whatever it is. I said, I will come. So that is the time, 1990. By the time I was finishing, that article came of first living donor transplant successful. 89, that Ria's unsuccessful living donor transplant from Brazil, and Russell Strong. Successful. So I got it. It is possible. What I was thinking is somebody has done it, but it is possible. Feasible. And so then Christopher Brolch, he had moved from Germany. He was with Pichelmeyer. He has moved to Germany, in Chicago he was. And he got the permission to do, as a pilot project, 20 pediatric liver transplant, living donor liver. So he Bismuth put me in contact with him. So I said, so he said, okay, after you finish with the Starzil, you come and see whatever is here. So after work there in the Starzil, so when I was coming out from the Starzil, now the person, he was a great man. I have seen him in the OR. People are operating. All these big men, Todo and Iwasuki and the other people. So he will, there is a call, he himself will go on the retrieval call. He will pick up any fellow, with him, come. He will fly and get the liver. Tum kaam, matlab, baki log, you keep on doing. So that was the thing I liked in him. He was the head of department, he was senior person, but the guy had that. So last day of my training there, when I said, I'm going now, I'm going back. And I was a little depressed because variant law was not there, 1990. And there was nothing on horizon also.
That's right.
So I told him, see, I've got all this training, but I doubt that I will be able to do the liver transplant in India because we don't have a law. So he said, oh, no, you can do it. So how can I do it? So he said, come. So we walked from the hospital to his office. His office was across the street, down the street. And I used to carry a big cup of, mug of coffee with him. Sipping. Walked to his office. The first road, we went up there. And he asked secretary, take out that 1990 article, transplant proceedings. And he gave me. He said, see, non-heart beating cadaver donor. Liver transplant. And the technique and all that, rapid cooling and all that. He said, read this, use this technique, you can do it. Go for the DCD, they used to call non-heart beating, not a DCD at that time. So, this is something. And then when I came back, I did those experiments in the dogs. So in the dogs, we make the heart to stop, wait for half an hour, take out the liver, and transplant into another drug and see whether it functions or not. Bile production was the way. That was the extension of that work. So from there I went to then Christopher Brolch, Chicago. And that time, in 6 weeks time, I observed and assisted also 5 living donor pediatric liver transplant. So that gave me the confidence that yes, it is doable and it can be done.
How we are so passionate about organ donation now. You are behind the organ donation movement and you are actively involved, and you you sort of keenly observe what is going in the transplant scene in Western world and the Western part of India. Is there a thing like a transplant, that is Tamil Nadu Transplant Society, is anything like a monitoring body in Mumbai?
Yeah. So what happens when I came back? So again there was no background. So of course we did a lot of experimental work. We got the coroner permission to do the non-heart beating cadaver donor also and transplant. And but at the same time I thought by 92 the bill was getting introduced. So the bill came for comments, different states. So in Maharashtra, I was one of the member of those people who were, that bill was circulated for the comments. So I know that now it is going to come. So I did make the comments and all that thing, and it came in the newspaper because there were enough people who were criticizing that this bill is not going to help anything and this and that and all that thing. And
BJP especially.
No, not BJP.
The Hindu.
No. It was
in
only
the parliament.
It was only our these nephrologists.
Oh.
Kidney transplant group. They say that the
in
cadaver transplant is not
from
going
Hyderabad.
Sab jagah se. Mumbai also. This is not going to take up and this thing. And I was a lone voice in Maharashtra writing in Times of India telling that this is the way it will go. This will bring it, and also which institution can do it. So that time I used to say all these interviews that AIMS and KM will be the first one to do the cadaver donation and transplants. History is different. So then I realized that unless we created awareness about the organ donation, this is not going to take anywhere. When the organ donation, this bill got passed, Maharashtra was the first state to adopt it because 3 states have to give the consent. So Maharashtra, Goa and Himachal Pradesh. Out of Goa, Himachal Pradesh were just namesake, but Maharashtra, they immediately formed an expert committee. So I was there, the late Dr. Acharya were there, there were 2-3 more people. And they said, how we are going to do it? And that's why then we said, how we are going to do it? Awareness, identification, making the people and donate the organ. So that is the time we looked at the UNOS model. And modified that UNOS model and adopted. So we said this was the first state in the whole country where the structure was created. Just in 95. They formed the meeting. So we had a meeting. So 95 to 3-4 years it took to crystallize the whole thing and where the government passed the whole thing. So we said state level there should be body, which we called as the Maharashtra Confederation for Organ Transplantation, short form MACFOT. And under that we divided the state into 4 zones because it's a big state. So we said every zone will be a zonal transplant coordination center. And then mimicking the UNOS model, these ZTCCs will be independent bodies, financial independent body created by the government to be registered as a society with the charity commissioner. So you raise your own funds and run your affairs. Government will not interfere. Government representative will be there to see that you are doing the work properly. So this was the first concept in the whole country. They were nowhere. So the structure was created. By 1999, the state approved authority issued the guidelines on disease organ donation and transplantation. So for each organ, there were 2-3 people who were experts who gave right from indication for transplant. So for liver transplant, what will be the indications? Living donor, what will be the indications? How will you select the donor? What will be the criteria donor? Heart, lung, liver, kidney, brain death identification, and also suggested at that time the transplant coordinators should be there. And there should be committee of these things for identifying the brain death and certifying brain death in each hospital. And what the government agreed that each hospital which will be recognized for transplant have to be member of the ZTCC. And then they say make a constitution. So the constitution was made that all these hospitals head will be the executive committee member. Now we call it governing council. So you collectively take the decisions where everybody is part of the decision maker. Then we said, okay, we should have expert committee member. So all the people who are doing the transplant, they will form separate committee, liver, kidney, this thing. They will advise on how to distribute the organs, fair way of. So that whole structure was put in and notified in 1999. much ahead of transplant. Transplant came in 2008.
Right.
As a matter of fact, I want to put it on record because late Dr. Veenacharya used to travel a lot in the country, and she was a nephrologist. So she used to talk to the people, and she taught them that this is the model which we are starting, and you should follow it.
Right.
So by 2008, when they saw that this model is working, in a modified way, transplant took it, Kerala took it,
Right.
Karnataka took it, and Andhra took it.
Right.
So they modified it, and they started doing the same thing. So that's how. So my involvement was from there. So that time I not only used to give the talk on the liver transplant indications and this thing in our medical societies, okay, or medical profession, but also was talking on the organ donations.
Right.
So it became full time when I gave up my liver transplant and doing the things in this thing.
Right. No, but you are a little ahead of the transplantation law, organ donation law, and all that. Now, if it was little later, by the time, because Dr. Nandi yourself are now but you excelled in a way that your students become transplant surgeons. When I asked Dr. Nandi, what is your biggest achievement? He said, my trainees. I'm sure it's with your trainees.
Yeah.
A lot of your trainees got inspired by you, and don't you sit back and think that, okay, I have done something good for the country?
Yeah, definitely. See, the thing is that in the liver transplant field, I think me and Dr. Nandi are contemporary.
Right.
Though otherwise he is senior to me.
Right.
Okay. And portal hypertension he is senior to me.
Right.
Okay. He started much ahead
Right.
these surgeries. He was doing work in the baboons. He used to do the transplant.
I used to be there, monkey
You
lab.
must have monkey. Yeah, monkey. And I used to do in the dog. Yeah, but that's the only difference between the two of us. As a matter of fact, when the act got passed, both of us used to go ISG conference and all that thing, and these gastroenterologists used to ask, between the two of you, who is going to do the first liver transplant? So we used to laugh at it. As a matter of fact, in Indian Journal of Gastroenterology, I have written the article, when liver transplant, are we ready in India?
Right, right.
And there I have written that AIMS and KEM will be the first one, because they have got all the infrastructure and this,
Right.
and the cost I have given, and but that Dr. Nandi has also given at that time, 1 lakh rupees for the transplant. That is UW solution and immunosuppression drug.
So, how happy and contented are you with your career? And do you think you're happy, satisfied that you've done your contribution?
Yeah, see, I look at the word satisfaction. When you use that, it hampers your growth.
Right.
Okay, that means you achieved, now it's okay.
Right.
No, I think that we should not have that thing. Ambition people cannot have the.
No, I think, see, the very reason you being so senior, you attend all these lectures religiously, and there's something you want to learn, you enjoy. Yesterday when I talked to you, you said, I don't want to miss this. I think that was a great thing. Not many do that. I think not many seniors of your seniority, you're still very, your thirst for knowledge and learning new is, and maybe that's the reason why you say that, still not satisfied. There's nothing like that.
Yeah, see, because see, there's so much of explosion of knowledge.
Right.
I told that some of the residents today, I was meeting the junior people when PK Reddy ke saath mein. And I told them, man, see, your level of knowledge at your age is far ahead of our level of knowledge at your age.
Right, true.
Because the explosion of knowledge, and one has to keep the pace. I can't learn everything.
Right.
Okay, but I should know it.
Right.
I should know it.
Right.
So that's what it is. So that desire should not end.
Right.
The moment you feel satisfied, it's like having a sumptuous meal. I'm satisfied now. Full.
Right.
Oh, no. The knowledge, you can never be satisfied. It is always a desire to learn more. And yes, I am happy. See, if I look back, I can say for me, Yes, I didn't become first person to do a liver transplant in the country. Fine. Okay, that circumstances didn't allow me to do it. The only my regret is I wanted KEM Hospital because that was my
Child.
Yes, that was the institution, public hospital where I spent all my time. If I would have been at the AIMS or Maulana Azad, I would have said something for them also.
Right.
I wanted this public institution to be the leading institution in the liver transplant. Okay. Unfortunately, that has not happened. Neither with the AIMS, nor with this, nor PGI Chandigarh. Means the places of which were temple of knowledge, temple of.
But that's beyond you. Government sectors do not.
Yeah. So now that's where the some of the medical politics comes into picture, where the regret in the mind. I don't want to say openly, but then yes, my regret is why I left KEM. I didn't retire. You know, so because I couldn't do it, or I was prevented from doing the liver transplant. So that dream got killed, that KEM would have been the leading transplant center in the country.
Right.
You know, so that's where you can say, okay, it is a little sore point in your heart which will remain. Otherwise, yes, see, ultimately I could do the liver transplant, though I had to wait for 16 years. 2006 I did the first successful then living donor transplant, did the cadaver donor transplants also. And then finally I said, okay, I've done everything. what you said, the portal hypertension from pill to transplant, I have achieved that.
On that note, sir, thank you so much for spending time with us, and I'm sure this will be an inspirational talk to many generations to come. How from a very small town with Hindi as your first language, you come so far and so much, and you've been your dreams almost, you fulfilled your dream, whatever. You trained students, you published, you did research, and I don't think any surgeon would dream anything more than this. Thank you so much.
Thank you, Patta, for getting me on this, and I'm sure that today money is the driving force for majority. I think that service should be the driving force, money will follow you. So it's a byproduct of our profession. Don't make it a primary production.
Thank you so much on that note. Thank you, sir.